Joyce Echaquan, a loving Indigenous mother of 7, tragically lost her life due to systemic racism. When she needed medical help most, she was met with dismissal and disrespect. Hospital staff treated her like an object, ignoring her pleas. In a desperate cry for help, Joyce went live on Facebook, exposing the extreme racist cruelty she faced. Nurses saw her as a nuisance, not a patient. The video sparked widespread outrage, protests outside the hospital, and government apologies. The incident led to firings and reforms, but did it bring about real change? The case of Joyce Echaquan. Joyce Echaquan, a 37-year-old mother of 7, was a loving and dedicated community member. She was proud of her children and loved life, despite her health struggles. Joyce had a significant medical history, including diabetes and heart failure. Joyce was hospitalized at the Centre Hospitalier de Lanaudière from September 26 to 28, 2020. She had severe stomach pains and other symptoms. She underwent tests, including an electrocardiogram and cardiac enzyme test. Joyce was diagnosed with epigastric pain and iron deficiency anemia. During her hospital stay, Joyce became agitated and was given medication including morphine, Ativan, and Haldol. Restraints were applied, and she was moved to a cubicle with an anteroom and toilet. This is when Joyce filmed herself on Facebook. She showed her distress and the denigrating words of the nursing staff. Her final moments were met with indifference. Joyce's condition rapidly deteriorated, and she became unresponsive. Despite delayed monitoring and discrepancies in her medical record, the staff finally noticed her distress. Resuscitation efforts were initiated, but unfortunately Joyce was pronounced dead at 12:44 p.m., the coroner's verdict. Coroner Gehain Camel's report highlighted systemic racism and inadequate care as contributing factors to Joyce's death. The report noted that Joyce would likely still be alive if she were a white woman. Kamel concluded that Joyce Echaquan's death was accidental, caused by inadequate care due to systemic racism. The coroner's report highlights that Echaquan's care was affected by assumptions and biases, including the incorrect assumption that she was suffering from withdrawal. Kamel urged the Quebec government to acknowledge and confront the systemic racism pervasive in its institutions. She backed her appeal with a comprehensive report. Her investigation reveals that Joyce Echaquan was mislabeled as a drug addict upon hospital admission. Despite consuming only prescribed narcotics in non-addictive quantities, the medical staff assumed she was experiencing withdrawal. The staff's bias and prejudice led to inadequate care, and Echaquan's concerns were dismissed as theatrical. She was placed in restraints, and her requests for help were ignored. Despite being calm, she was prescribed a chemical restraint, Haldol, without being seen by the doctor, who endorsed a diagnosis of withdrawal without evidence. Echaquan's behavior varied, and she was transferred to another room, isolated and restrained. At 10:27 a.m., she live-streamed a video on Facebook showing hospital staff making racist and condescending comments, including remarks about overdosing her with drugs and being better off dead. In a shocking display of racism and disrespect, a nurse kept hurling vile insults at Joyce, including calling her a F-king idiot and suggesting she was better at sleeping around than anything else. The nurse later broke down in tears during testimony, apologizing profusely and claiming she didn't recognize herself in the video. She also claimed that she was overworked. Joyce Echaquan's brother, Stefan, was deeply disturbed by the Facebook video showing his sister's desperate cries for help and the racist treatment she received from hospital staff. Stefan testified at the coroner's inquest, describing his sister's restraint as like an animal. The inquest also heard from Joyce's daughter, sister-in-law, cousin, and friend, shedding light on the devastating events surrounding her death. Stefan's own distrust of the medical system led him to delay treatment for his kidney issues. The family's distrust grew after Joyce's death, with Stephanie emphasizing that no one should face differential treatment due to nationality or cultural background. He highlights the broader scope of racism, sharing how his children faced bullying and threats at school, denial, and downplaying. Healthcare staff's response. The nurse and beneficiary attendant involved in Joyce Echaquan's care attempted to downplay their actions. They claimed their comments were benevolent and meant to provoke a reaction from her. However, their denial of racial prejudice and lack of introspection raises concerns about their compassion and understanding. The manager's delayed response and failure to investigate similar incidents in the past highlight systemic racism within the healthcare system. One arbitrator ruled that Miriam LeBlanc, a hospital orderly who was fired after the death of Joyce Echaquan, should have been reinstated. LeBlanc had made inappropriate comments toward Echaquan, but the arbitrator found that she was not responsible for the bulk of the poor treatment Echaquan received. The arbitrator noted that LeBlanc's actions were not comparable to the insulting, vulgar, racist, and rude remarks made by the nurse, who was also fired. The decision to fire LeBlanc was likely motivated by media and public pressure, rather than the severity of her breaches. It's appalling to see healthcare staff attempting to downplay their cruel and racist behavior towards Joyce. What we need is true accountability to prevent such tragedies from happening again. The aftermath. Joyce Echaquan's death resonates with Indigenous people across Canada, who see it as part of a larger pattern of systemic racism. Her husband and Indigenous leaders emphasize that Echaquan's the system needs to be repaired. They accuse the Quebec government of overlooking its responsibilities and changing its position on systemic racism. The Commission des droits de la personne et de la jeunesse defines systemic racism as a combination of biased attitudes, policies, and practices that create unequal treatment, often without intention. Joyce Echaquan's experience is tragically not an isolated incident, with members of her community sharing similar fears and experiences. Quebec Premier François Legault responded to the inquiry, disagreeing with the coroner's finding of systemic racism. He claimed that systemic racism requires a deliberate, top-down approach, which he doesn't see in the healthcare system. However, Indigenous leaders and advocates argue that systemic racism can manifest through inaction and existing systems. They accuse the Premier of trying to divert attention and create division. The coroner defines systemic racism as when the system folds in on itself, leading to tragic outcomes like Echaquan's death. Recognizing systemic racism is crucial to prevent similar events and ensure Indigenous communities have equal access to healthcare. The family of Joyce sought $2.7 million in damages from the Regional Health Authority, a nurse, and a doctor. The family alleged that systemic racism contributed to Echaquan's death, and that the health authority failed to address concerns about inadequate care for Indigenous patients. The lawsuit sought punitive damages and compensation for Echaquan's husband, mother, and 7 children. The family also called for the adoption of Joyce's principle, which aimed to ensure equitable access to health care for Indigenous people without discrimination. The Joyce Principle and the ongoing fight against systemic racism. After the tragic death of Joyce, Quebec's official opposition pushed for the adoption of Joyce's principle. This principle recognized systemic racism in the province's healthcare system. The opposition party wanted to amend Bill 32, which aimed to improve cultural safety in healthcare, to include Joyce's principle. Indigenous groups in the Quebec Liberal Party argued that acknowledging systemic racism was crucial to achieving cultural safety. However, the Coalition Avenir Quebec government denied the existence of systemic racism, sparking criticism and protests. The federal government and several organizations had already adopted Joyce's principle, but Quebec had yet to do so. The family and community of Joyce Echaquan continued to seek justice and change years after her tragic death. This emphasized that the Indigenous people's safety and healthcare was still at risk. The lawsuit, while seeking accountability for Echaquan's death, aimed to spark broader reform and ensure safer healthcare experiences for Indigenous individuals. The community's patience wore thin as they awaited meaningful action, with Grand Chief Constant Awashish hoping the lawsuit would accelerate progress. 3 years after Joyce Echaquan's tragic death, a memorial march was held in Joliet to honor her memory and continue the fight against systemic racism in healthcare. The event aimed to remember Echaquan's life and legacy, and to push for change to ensure equitable access to healthcare for Indigenous people. Despite some progress, discrimination against Indigenous people in healthcare remains a persistent issue, with reports of incidents continuing to be made to the Joyce Principal Office. The office, established in memory of Echaquan, is still working to promote and adopt the Joyce Principle, which guarantees equitable access to healthcare without discrimination for Indigenous people. In the context of Joyce's case, cultural safety is highly relevant as it highlights the need for a healthcare system that values and respects Indigenous cultures, addresses systemic racism, and provides equitable care to prevent similar tragedies. Joyce's case is indeed a heartbreaking reminder of the devastating consequences of systemic racism in healthcare. But it's also a call to action, a reminder that we all have the power to create change. We must continue to push for meaningful change, advocating for policies and practices that prioritize cultural safety, equity, and justice. Thank you for watching, and please subscribe to our channel for more content on social justice and health promotion.